Hi, folks. My name is Greg Turner, the radiology coach. My job is to demystify the enigmatic world of X-rays. Anatomical planes are invisible planes that bisect the body into different hypothetical segments. They are useful when learning how to position a patient's body part or when determining where to direct the X-ray during an exam. As an example, when performing a PA chest examination, the patient stands with their chest against a wallboard with their shoulders rolled forward. Using technical syntax, the X-ray operator must center the X-ray beam posteriorly to the mid-sagittal plane of the body at the horizontal plane of the 7th thoracic vertebra. To the average layman, this sounds a bit like technical jargon, but when one masters positioning terminology combined with anatomical landmarks, it comes together and can easily be remembered and used. As stated in our chest X-ray example, the centering point of the X-ray is directed to the mid-sagittal plane. The word sagittal originates from the Latin word sagitta, which means arrow. The visual that one can glean from this meaning is when a person has been shot by an arrow, typically from front to back. The arrow strikes the person at a perpendicular angle. Adding to this, the skull is made up of several thin bones that are connected by sutures. Each of these sutures has a designated name. The suture that runs across the top of the head from the front to the back is labeled as the sagittal suture. It divides the skull into a right and left portion. It is consistent with the imaginary perpendicular line that an arrow traversing the body would create. Furthermore, extending this plane vertically down toward the thorax and abdomen, dividing the entire body into left and right segments, the mid-sagittal plane runs from the sagittal suture of the skull down to the symphysis pubis of the pelvis. There are two types of sagittal planes, the mid-sagittal plane and the parasagittal plane. As mentioned, the mid-sagittal plane bisects the body into two equal parts. A parasagittal plane runs vertically through the body in unequal parts, often placed in a specific or relevant position. Another invisible line that runs at a 90-degree angle to the mid-sagittal plane also divides the body into halves. The coronal plane divides the body into front and back halves. The frontal segment is also termed the anterior segment. The backside is referred to as the posterior segment. This plane is an imaginary dividing plane that runs vertically down the body from the top of the head to the undersoles of the feet. The transverse plane, axial plane, or horizontal axis divides the body into a top and bottom part. The top portion is referred to as the superior portion and the bottom portion, the inferior portion. The height at which this plane bisects the body can vary, but it is important to understand that the plane divides the body horizontally. The mid-sagittal and coronal planes divide the body into four parts: the anterior portion, posterior portion, right portion, and left portion. The parasagittal and transverse planes create more irregular segments. A final plane is the oblique plane. This imaginary line traverses the body vertically, but at various angles. It could run from behind the right shoulder through the body and exit at the sternum, or it could run from the left scapula to the right shoulder. The point is that it is a vertical plane that unequally divides anatomy into random sections. The planes of the body are used for radiographic positioning, anatomical landmarks, and references to medical approaches. They are also frequently referred to for CT and MRI cross-sectional imaging. Understanding the anatomy of the body is extremely important in the medical imaging industry. But putting this anatomy into context is equally important so as to accurately achieve precise studies and images. That concludes this section on what are radiographic anatomical planes. If you like this presentation, please select the subscribe button below this video. You can also tap the bell next to it so that we'll notify you when other great videos have posted. My name is Greg Turner, and I'm the radiology coach. And remember, mark my word and mark your films.